People who have chronic pain often go to the extreme to get temporary relief, but our next guest says for lasting results, you need to do more than just treat the symptoms. You need to address the cause without prescription drugs or surgery. Joining me now is Dr. Christopher Rago, a licensed chiropractor at New England Spine and Disc, along with his patient Diane Novick. Thank you both for being here.
Thank you for having us.
Doctor, first talk to me a little bit about New England Spine and Disc. Give us an overview.
Sure. So New England Spine and Disc is a revolutionary facility. It's quite unique in the state of Connecticut. We are chiropractors, but our main focus is on disc type injuries and more severe surgical type injuries.
But it's non-surgical treatment, correct?
Our treatment is an alternative to the surgical and medical approach. So we have options that are non-invasive, non-medicated, and non-surgical.
But you could still get the results you're looking for.
Absolutely.
And Diane, that's where we'll lead into you. Tell us your initial problem and why you contacted Dr. Rago.
Initially, I was told that I was going to need spine surgery for herniated disc, L4-5 area. And I said, I'm not so sure about this. And then I had several other things going on at the time. So
Did you injure yourself initially, or how?
Yeah, I fell backwards and landed really hard, and that lower area just must have decompressed, I guess. Or,
yeah, usually with a trauma, a lot of times the disc can actually break and can cause a lot of issues.
And what was the treatment for Diane?
So for Diane, she had a lot of pain going down into the legs as well as low back pain. So what we did with her was we put her through the decompression and laser therapies that we have at our office. The decompression is non-surgical decompression, and what it does is it actually will help to open the space between the bones where the disc lies, allowing that pressure on the nerves that are sending the signal down the leg to be alleviated.
Okay, in fact, we're looking at the procedure right here.
Yep, this is the DRX 9000. This is our decompression unit. It is designed for disc herniations, stenosis, arthritis of the spine, severe pain into the legs.
All right, and we also have the New Life laser, which is what we're looking at here.
Yes.
This was part of Diane's treatment as well?
Sure. So what the laser actually is, it's a class 4 laser. It's non-surgical, it's non-invasive, there's no side effects. It's concentrated ultraviolet light. And so what that does is it stimulates those damaged cells of the disc and will actually increase the potential for them to regenerate and heal.
We're looking at kind of a demonstration here treating patients. It looks painless.
Sure, there's no pain at all. The only thing a patient will feel will be a slight amount of heat and warmth, which everybody says is therapeutic and very helpful.
Sure. Diane, would you would agree with that? You didn't mind any of the treatments?
Actually, it's very comfortable and it's very relaxing, if anything.
Great. Yeah, show me how it works, Doctor.
Yeah, absolutely. So the laser itself is applied directly to the skin.
Okay.
As you can see, let's get it started here.
All right. Typically, how many treatments would a patient need, or does it vary between patients?
Really, it depends on the condition. Generally, a few times a week for about a couple months is the typical treatment. You know, we're not changing things that happened overnight. These are processes that occurred over a long period of time.
Sure.
And so it takes time to regenerate that tissue.
Makes sense.
The best part about it, as you can see, there's a little guide light, and it's applied directly to the skin. The patient sits back and relaxes. Yeah, exactly. And a lot of patients really do. If we're working on the low back especially, they're laying on their stomach.
Sure.
They end up, sometimes dozing off.
Not so bad.
Absolutely.
Dan, what have you been able to do, like activities you might not have been able to do prior?
I was really not able to walk through Stop and Shop and Home Depot and those stores, and now I am able to walk. I'm able to really function. My quality of life is so improved.
Oh, that's terrific news. Great. And Dr. Rago, I know that you guys have some special offers for Connecticut Style viewers. Tell us.
Yeah, so for anybody who calls in who sees the segment, we offer 2 free consults to begin with to introduce the therapies, as well as get a chance to meet the doctors at New England Spine and Disc and see if it's something that would be worthwhile for your particular condition.
All right, well, let's put the information up on the screen. You can call today for 2 of those free visits. You could visit the website, which is right there on your screen. It is newenglandspineanddisc.com. The phone number is 1-800-PAIN-FREE or locally at 203-799-3472. Doctor, thanks for being here, and Dan, thanks for sharing your story.
Thank you.
All right, up next, Lori Green shares her delicious recipe for bread pudding with a twist. When Style returns, we'll be right back.